Vascular laboratories must offer multiple diagnostic services to patients in a single setting. Consequently, vascular technologists, students, and physicians are being asked to learn and participate in duplex imaging studies. A thorough understanding of hemodynamics is essential to successfully perform color and spectral Doppler imaging. A model was created to provide visual and interactive demonstrations of frequently encountered hemodynamic states in the human body. Several blood flow patterns are commonly displayed during duplex imaging of the peripheral circulation. Laminar flow, streamline, turbulence or disturbed flow, boundary layer separation, and flow reversal are all visually displayed in this model. Laminar flow is defined as flow in which multiple patterns of red blood cells are moving in straight lines parallel to the walls of the vessel. Streamline is a line traced along a single lamina. Turbulence or disturbed flow is disorganized flow chaotically oriented in many directions simultaneously. The boundary layer is the thin layer of stationary fluid in contact with the walls of the containing vessel. A standard continuous flow pump is used to circulate a translucent liquid through the connected modules. A hand-operated valve allows the user to control the amount and velocity of the circulating liquid. To activate the model, an on-off toggle switch is located in the upper corner near the pump. The flow rate is adjusted by turning the flow rate valve. Each module has an optimal flow rate. However, users are encouraged to experiment with a variety of settings to create different visual effects. The modules are made of glass segments fashioned to simulate different hemodynamic states. A carotid bulb, an aneurysm, an aortic bifurcation, a tortuous vessel, and the effects of a long stenosis versus multiple stenosis in a series. Module 1 demonstrates 3 varying states of stenosis: mild, moderate, and severe. For optimal viewing, the flow rate should be adjusted to slow. As the degree of stenosis becomes more severe, one should observe an increase in disturbed flow. The separation of the boundary layer becomes more evident as the stenosis tightens. This color Doppler segment demonstrates disturbance of flow distal to the moderate stenosis. The disturbed flow is accentuated as the stenosis becomes more severe. Module 2 demonstrates tortuosity in a vessel. For optimal viewing, one should adjust the flow rate to fast. This module shows the effects of curvature to the streamline profile. The fastest moving fluid at the center of the vessel accelerates toward the outer edge of the curve, skewing the streamline. This acceleration causes a rotation of flow, and a helical component is observed as the flow exits the curve. The colors in this duplex segment change as the velocities accelerate along the path of the streamline. Module 3 demonstrates a carotid bulb. The flow rate should be adjusted to fast. In this segment, one can observe the turbulence that occurs when fluid traveling in a laminar profile enters a larger chamber. A separation of the boundary layer from the vessel wall occurs with a small amount of fluid flowing in a retrograde manner toward the region of lower pressure. This colored Doppler segment shows flow separation occurring at the origin of the normal internal carotid artery and in the area of the carotid bulb. Module 4 demonstrates an aneurysm. The optimal flow rate is medium to fast. Flow patterns in an aneurysm are dependent upon aneurysm size and the amount of thrombus contained within. In this module, there is an open aneurysm, free of debris, and violent disruption of the streamline is observed. A high-velocity jet into the central axis slows and gives rise to eddy currents with a reversed component. The color Doppler segment illustrates the blue-red of disrupted flow in this aneurysm. Module 5 demonstrates entrance and exit effects in a long stenosis. The optimal flow rate setting is slow. In this segment, upon entering the stenosis, one will observe an initial funneling of the flow. Gradually, if the stenosis is long enough, laminar flow is reestablished. At the exit, there is a separation of the boundary layer and the fluid flows in a retrograde manner towards the region of lower pressure. This duplex Doppler segment demonstrates these flow characteristics within and at the exit of this long segment of narrowing. The Venturi tubes in Module 6 demonstrates the drop in pressure over a narrowed lumen with increased velocity. When fluid flows from one point to another, its total energy along any given streamline is constant. This is in accordance with the law of energy conservation. Bernoulli's principle expresses the relationship between pressure, gravitational potential energy, and kinetic energy in an idealized fluid system. The main components of total fluid energy are pressure and kinetic energy. With an increase in kinetic energy or velocity, as seen in stenosis, there is a corresponding drop in pressure. Within our bodies, muscles and soft tissue exert an external force against the blood vessels. Blood pressure supplies the opposing force, so these vessels will not collapse. During systole, the velocity in a stenosis can increase enough to lower the intravascular pressure to less than the atmospheric pressure, and the vessel closes. During diastole, the process reverses, and the vessel reopens, as seen in this example of a stenotic hemodialysis graft. Module 7 demonstrates a single stenosis versus multiple stenoses in a series. A flow rate setting of medium is optimal. Multiple stenoses occurring in a series will have a more pronounced effect on distal pressure and flow than a single lesion of equal length. This occurs because large amounts of energy are lost at the entrance and exit sites. This segment demonstrates a single long lesion in comparison to a lesion of similar length with multiple entrances and exits. There is grossly disturbed flow with turbulence at each exit. Module 8 demonstrates a bifurcation. A flow rate of medium is optimal here. The geometry of a vessel plays a major role in the streamline profile. At bifurcations, boundary layer separation is found to varying degrees. This segment demonstrates how helical flow develops in the branches. The flow profile eventually returns to laminar or parabolic flow in a non-obstructed straight vessel. This interactive model of fluid dynamics provides some insight into the movement of fluid through complex pathways and a demonstration of hemodynamic states encountered in the human body. When activated, flow patterns are easily visualized within the individual modules. The model does not attempt to replicate the distensibility of the circulatory system, nor does the pump recreate the pulsing action of the heart. Users must keep in mind that the model simulates steady flow through rigid tubes, although many of the flow states which are generated are commonly encountered in human hemodynamics. Using this model enhances the knowledge of vascular disease and provides a necessary link between theoretical hemodynamics and actual flow states.